Welcome back to another episode of The Birth Experience with Labor Nurse Mama, where we empower and educate you on all things birth and motherhood. This is Trish, and today we have an incredibly insightful episode for you. We're going to dive deep into a topic that affects so many new mamas and their babies, tongue tie. Joining me today is a leading expert in the field, literally like one of the few, Lisa Paladino, and she has dedicated her career to understanding and treating this often missed or overlooked condition. And she has helped countless families navigate these challenges. She also trains experts on how to recognize, how to get the right treatment, and help parents navigate tongue tie, which is huge and necessary. In this episode, we're going to talk about what tongue tie is, how it can impact breastfeeding and oral development, and what you can do if you suspect that your baby has this condition. So whether you're an expecting mama, a new parent, or someone who supports women through the journey of tongue tie, this episode is for you, and we have more links in the show notes if you need more information. So let's welcome Lisa to the show. Hey everyone, we have a great topic today. The guest that I have on today is an expert, and I am so ready to dive in. We have with us Lisa Paladino. Lisa, I'm just going to let you do the honor of introducing yourself. Just tell everyone who you are and how you got started doing what you're doing.
Sure. And thank you so much for having me, Trish. This is a thrill. As I started out as a labor and delivery nurse, and talking to any labor and delivery nurse is an honor because we're a special breed. Nobody else understands the role of an L&D nurse unless you've been one, right?
True.
So I was an L&D nurse, and I always knew that I was drawn to pregnancy, childbirth, and everybody always said, oh, it's just because you want to have babies. And that wasn't exactly the case. I knew that's where I wanted to be. If I had known before I went to nursing school that there was a such thing as a nurse midwife, I would have gone straight there. But at the time, it was just really I'm old. So it was just being established as a career. So I didn't even know about it. So I go to school, I go work. First I had to work in the medical floor, as most RNs don't start out in medical, allowed, quote unquote, to work in maternities. And then I had to work in the nursery for a while and the postpartum floor, which at the time it was totally separate, nursery and postpartum. And all the while just wanting that chance to be in labor and delivery. And finally, after a couple of years, I was allowed to work in labor and delivery. And I have to tell you, it wasn't what I thought it was going to be. And that's why I said most of us have no idea what it is. And I thought birth was going to be different than it was. I expected a more natural experience. I learned a lot about how to work a monitor and IV drips and all this stuff. But I was always a touchy-feely. I wasn't running to triage. I wanted to be the hand-holding nurse. So
I feel like you're telling my story right now. Like I could predict the outcome.
So then these two very brave women who were nurses with me decided to go on to midwifery school, and they were my inspiration. I couldn't believe that this was a thing, and they did it. And they came in charge of the patients, which to me was like awesome. Because as an L&D nurse, for those who are listening who don't know, we do everything. And then the doctor would run in and get the glory of, oh, I caught the baby. That's the easy part. So I was like, I can do this. So I started going back to school. They inspired me. I started going back to school part-time because I had only had my associates. So I went back to school, and little by little, I got my bachelor's degree in nursing, and then I went on for my master's in midwifery, did an internship at the hospital I worked at, which is interesting because one day I was working as a nurse, and the next day I was working as a...
interesting. Yeah.
I would have to I did things to differentiate myself.
Your role for the day. Yeah.
Today I'm the midwife, or today I'm the nurse, different color scrubs, or a white jacket when I was the midwife or whatever. But at that same point, I started realizing what I didn't know about breastfeeding and how little we learn in our education about how to support women breastfeeding. We learned it's important, When I went back to when I was first in school, it wasn't even that important because this was going back in the 80s. It wasn't that important. But as we went on, we still learned that it's important. We learned that it's best, whatever the heck that means. But we don't learn how to manage breastfeeding, and we don't learn beyond the simple things.
Besides forcing moms to do it,
Forcing moms to do it. If mom's got pain in her breast, it must be mastitis. The simple, silly things. And if anybody's got to take any medication, they have to stop breastfeeding. That's what we learned. And so we started a breastfeeding initiative. I'm in Staten Island, New York. And we're part of New York City, and Staten Island started a breastfeeding initiative based on New York City was having there was a major grants program to New York City hospitals, but they didn't include us because we're not in the heart of the city. So a friend of mine and myself rallied like politically. We became political activists.
nothing like a labor nurse to get shit done.
We forgot to tell the person in charge of the hospital, and they got a call from the mayor's department. And they're like, what is going on down there? Who's making these calls? Who's sending these letters? But anyway, we got a grant. The breastfeeding initiative was established. They needed somebody to run it. And this happened concurrently with me graduating from midwifery school. My boss at the time, who became like one of my best friends and mentors, she said, Lisa, do you want a job? If you want a job, it's yours. You'll be in charge of the breastfeeding initiative. You have to write the job description. What I did was part-time midwife, part-time, like halves. I split it in half. And I was for 8 years, that's how I worked. And we were trying to make the hospital baby friendly. But the only problem was I was the only person trying to make the hospital baby friendly. Nobody else really
It doesn't
cared.
work. Yeah.
So it didn't really work. And after 8 years, I waved my white flag and said, enough. But getting back to what I do right now. So I left there in 2015, started my private practice. I'm in private practice now. And so at that point, when I was in charge of the breastfeeding initiative, it's like, I better get more breastfeeding education. So that's what I did, because I can never stop going to school. After midwifery school, I started training in lactation, got my IBCLC, and started people were sending mommies and babies who wanted to breastfeed and were having struggles to me because they just associated me with breastfeeding. And then that was great. So when I left the hospital, I was doing like a mixed kind of practice with breastfeeding, GYN, whatever. And then all of a sudden I had a bunch of babies that I couldn't help. So I did all the tricks I knew to get these.
This is why I'm so excited to have you here.
Yeah. Yeah. So it was like, I'm doing all the things they taught me. What the heck is going on? And I started hearing about tongue tie. And honestly, I was a midwife. So I was like, 0 interventions. Why would we need to do something to a baby's mouth to help them feed? They should be able to feed. So I tried to ignore the issue of tongue tie. And I had 3 babies in 1 week who could not latch, and I couldn't get them to latch. And then one of those moms said, I think my baby might have a tongue tie. And she on her own found someone to release the tongue tie and came back to me and showed me. She taught me. Now my baby can feed. She was very lucky, that baby. It was a simple case because it's not always that cut and dry, right?
No. Yeah.
And so I said, I better start learning about this stuff. And because of where I live and because there wasn't a lot of lactation and there was nobody that knew about tongue tie, everything I learned was more than anybody else knew. So I started being seen as the person to send to for tongue tie. So I went in that direction and I started learning about it, going to all the conferences, joining all the organizations. If there's something to learn about tongue tie, I've done it. And now I run, my brand is Tongue Tie Experts. But I like to always say, and I know you introduced me as a tongue tie expert, but I like to say it's not me that's the expert.
I really didn't.
Yeah.
I let you introduce yourself because I don't know that I've ever seen a CNM who's an IBCLC who's also a tongue tie expert who was a labor nurse. You're a unicorn.
Yeah, it's a niche.
Oh, for sure.
Yeah.
100%.
But I like to say I'm not the expert. The people that are the experts are the people the parents, first of all, because as I just told you, I learned from a parent. And the people I interview on whether it's on Instagram or on my own podcast, They are the experts. And I like to bring together the experts and bring them to bring them to parents. So my following and my world is parents and professionals who are curious or need to learn about tongue tie for whatever reason. And we learn together. And I have parents courses, I have professional courses, which I think is probably the most important thing, is to teach other professionals.
I don't even know the words to say, because here, let me tell you, my little bit of a journey to finding you, because I reached out to you, is that I have my birth classes. My birth classes include weekly hangout, weekly support call on Zoom with me or one of my doulas. And then we also have a membership, AKA our family ship. I don't know what to call it, but we're like a family. My girls can also opt in. They get 30 days free when they buy the birth classes, and then they can choose to stay. It's $19 a month. It includes our monthly mindset coach. We have weekly postpartum hangouts. We have experts come in and do workshops. I do workshops. Our doulas do workshops.
Sounds beautiful.
We have the most incredible chat text message going on, a group text with our girls, both postpartum and pregnancy and waiting for baby. I'd love to have you come in and do a workshop. And here's why I got to the place where we were looking for someone who could educate us more on tongue tie. Because as a labor nurse, and you'll understand this, I've never spent a significant amount of time with postpartum moms, minus the few of my friends in my own life. But when you're in the midst of postpartum yourself, who has time to actually learn from one another because you're surviving? So for the last couple of years, every Thursday, I hang out with my postpartum mamas, my students, my members, beyond them having their baby. And it's given me this other side of perspective from postpartum mental disorders like rage and sadness and fear. We've talked about abuse. We've talked about relationships. We've talked about sex. We've talked about fears, in-laws, your own parent problems, but it's also allowed me to walk their journey with them and their babies. And I have learned so much, but I kid you not when I say that probably 60 to 70% of my mamas, their babies have one form of tongue tie or other. Like, it's blown me away. And I'm wondering to myself, has this always been the case? Are we just aware of it now?
So maybe not. I can address that if you'd like.
I would love that. That is a huge thing I want to know.
Yeah, I get this question all the time. And from the great minds who I have learned from, I didn't make this up. There's a dentist named Kevin Boyd. Look into his work. He's actually an anthropologist and a dentist. So he has looked at...
I'm going to write this down.
Yeah. Kevin Boyd, Boyd. I'm sure he'll love me shouting him out. And I've actually had him on my podcast, but he lectures about the epigenetic changes that have happened to the face and jaw, right? So now this gets us down a rabbit hole, because tongue tie isn't an isolated problem. It's an aspect of the changing faces that we have. If you think about the tongue not being able to move appropriately, or the tongue being able to move appropriately and lift appropriately against the palate, the top of the mouth, is what starts the formation of the shape of the whole face. So babies with tongue tie often have high palates, which means they're going to have narrow sinuses, because the top of the mouth is the bottom of the sinus. So fast forward that to adulthood. Think about the amount of sleep apnea we have.
Yeah.
It's an epidemic now. People cannot breathe when they sleep. That's all related. Not to scare any mom whose baby is having trouble breastfeeding that they're someday going to have sleep apnea. That's not what I'm saying. But there is a trend towards a changing shape of the face. So is there more tongue tie? Possibly. But is it related to, for a few generations, there was no breastfeeding?
We had no information either. When you and I were breastfeeding our babies, we didn't have information like this. We had to go to the library. And who has time to go to the library and look things up with other babies?
Right. Yeah, exactly. And there was no community. There was La Leche around here, but it was very like hippie and a little bit And excuse me, any La Leche leaders that are listening, but at the time it was a little militant.
Yeah, I went to La Leche with some of mine. I liked it to a point. It's like Bradley instructors. And sorry if you're listening because I know some amazing Bradley instructors, but part of my story and why I do what I do sounds a lot like Bradley instructors, your story in the beginning. But when I was having baby number 4, my Gavin, I wanted to do something a little different. I already had unmedicated birth, but I wanted to have a peaceful unmedicated birth. And so I took a Bradley course. And for any of you guys listening, we go off on weird tangents, but this is one of them. Anyway, I became what I thought was very good friends with my Bradley instructor. We got our kids together. Here I was, this really young girl, because just so you guys know, I had all 4 boys by the time I was 25. I was a young mom from Florida, total city girl, not country living girl, but I'm living in Tennessee, making bread with this Bradley instructor, all the things. She had chickens, and I remember being like, chickens? Anyway, long story short, Gavin ended up turning breech. And my midwife was like, hey, let's do an ECV. If you don't know what that is, that's an external cephalic version for those of you guys listening. If he doesn't turn, I'll induce you and we'll still do the delivery, a breech delivery. Like she was going to deliver me vaginally breech, but she didn't want me to go to full term because according to like palpating and even ultrasounds, which are often wrong, but according to my own body for my 4th pregnancy, I knew he was a bigger baby. And he turned out being 8 something at 38 weeks. So who knows what he would have been if I went full term. And I made the decision for myself. That was what I was comfortable with. And I loved my midwife. I picked her well. I loved her and I trusted her. So we go in, we did a successful version. I had a beautiful, unmedicated, induced birth because when he went head down, I decided to let them induce me. But that being said, my Bradley instructor never spoke to me again because I didn't do what I was told. And I am not like that in any way with my students. You don't impose what you think is right on someone else. You give them the education. And this is why I do what I do. This is why I left the bedside and I'm pursuing this, is because I don't want to be the one bullying and coercing. I want to lay it out. My students say that I'm crunchy with a side of medical and that I lay it out for them like a smorgasbord or a buffet, and I let them choose what's best for them. And then I support them because it was so hurtful to me as a young mom.
Lynn, she wasn't a good friend.
No, she wasn't a friend.
No.
That's the whole point of that.
I know another tangent, but the way you say that you lay it out and you educate and you let them decide, I'm the same way about tongue tie because there's no absolutes. And I firmly believe that every mother knows what's best for her baby. And that's the only absolute there is. And I think that with the right education and support, every mother will make the right decision for their baby. So if I tell you your baby appears to have an oral restriction or a tongue tie or a lip tie, I'm not saying you have to have a procedure. I'm saying this is what you need to learn about it. This is the symptoms that I see. Let's see what we can do without release if that's not what you want to do. And you take all that information. And even if you said, you know what, Lisa, you're crazy, I don't want to do this, you need to know. I give them what we know in nursing as anticipatory guidance. If you don't do this, look out for this and this. And even if you do that, still look out for this and this. Because chances are I'll never see you again. And other people may not look back at your history or the baby's history of poor breastfeeding as a red flag for some of the things that could come later. And more, I am looking at breastfeeding as like a vital sign, or if it's not going well, a red flag that something is up, because babies are supposed to breastfeed. Whether we choose to breastfeed or not, babies they're born to breastfeed, right? That's survival. We're mammals. We feed our babies at the breast. And when that doesn't work, something's up somewhere. Now, sometimes it's just, as an L&D nurse, all the interference that can go in to birth, right? All the things that we do to women that interfere with the natural process can affect the baby, can affect the mom. Sometimes there's lack of education. I've had women in my office who have no idea how to hold a baby.
No, yeah, that was shocking to me when I first started as a labor nurse. I always tell my girls that I walked in there like I had already breastfed 5 babies.
Oh, wow.
I was like, I'm going to be the queen of breastfeeding help with my people. They're never going to need a lactation consultant. And then I never have sweat so bad as I have when you can't get a baby latched. And a lot of times it's just simple mechanics of her body or baby's mouth and holding the baby. Yeah. And even her anxiety can really interfere.
Mhm. Absolutely. So, yeah, so I even bring in like breathing exercises to my patient care. Baby's screaming, mom's freaking out. We do skin to skin, calm the baby down. And then I tell her, take a deep breath. And this is great for anybody listening. This is like something that I don't know where I got this from, but it works. Take a deep breath. And when you exhale, drop your shoulders. And I tell them to do that 3 times when the baby is on them, near them, about to come on, because you will not have letdown if you are not breathing, right? It's just
No.
biologically impossible. Your stress response holds back the milk. So your stress, every time the baby cries, if you clench and stress, it's going to prevent anything good from happening. And the baby picks up on that stress, right? So that breathing really helps. That's like most of what I suggest in my practice, in my online whatever, in my classes is really simple and basic. Like I said so far, trust your instincts, take deep breaths.
I love that you say that because one of my most powerful free classes that we do as an introductory so people can like get used to my teaching style and my community and get a glimpse and want to join us. So if someone's going to join me, I want them to be like, yeah, I want to join her. I like her. I like how she does this. I like her teaching style. So I do this class. It's all about the pain of labor. People forget we're mammals. And there was a time and a place when we didn't rely on hospitals and houses, and our bodies were designed in a certain way. And when you get anxious, when you get afraid, whether it's a nurse coming in at you really fast, not explaining what she's doing, and you get scared, or you're out in the wild and another animal's attacking you, your body produces the fight or flight response that is amazing out in the wild. If an animal's attacking you, you need to run and fight because it will slow down or even stop your labor. And I tell my girls all the time, I'm 100% that this is a huge reason why so many women end up in the OR is that staff does not think outside of the box. They do other things besides what we're taught. And our bodies, it just makes so much sense.
And how many labors stop in the triage room?
Exactly.
And that's normal. Because it doesn't feel like a safe place.
And our bodies, it makes so much sense because our bodies are designed so beautifully that, of course, if you're out in the wild and a tiger is going to attack you and your labor needs to stop, your labor needs to stop. Yeah. And your milk to stop flowing so you can take care of business.
Yep. Because when you're being chased by a lion, you're not going to stop to feed the baby.
No. So it all just made such logical sense. But what doesn't make sense is that most medical providers, lots of labor nurses, lots of OBs, and I call them midwives, do not understand. You're the problem. Make her feel safe. Support her. Yeah.
Right. And the scary things that we say to women. And I say that I actually have PTSD from my labor and delivery days where I did things that I now regret. I spoke in ways, I touched in ways that
I know.
I didn't know about asking permission. It's terrible, and I regret it, and I apologize. Like every time I talk, I'm like, if I took care of you, I'm sorry. But the sad part is that most women don't even understand they're not getting treated well.
This is the part that's hard for me. And that is what makes it difficult to even sell the birth classes because I also do business coaching for women in the perinatal mom space. And I tell my clients all the time, if they know the pain problem, so let's say you're a sleep consultant, they know, like these parents coming to them, no, I'm not getting sleep. I need help. They know they need help. Super easy. But in the birth space and birth education, women do not realize how detrimental it can be to walk into the hospital without the right knowledge. And I am 100% not a fan of hospital birth classes. I've been asked to teach them over the course of my years, and it's very intertwined with policy and procedures. And that I'm not a fan of. Sorry if you're listening, you teach one, but I'm not a fan. This isn't about what the hospital or the doctor wants. This is about what she wants and what she needs and what her body is capable of. I'm getting fired up right now.
Same.
Go back to one of my early episodes and listen. If you're listening right now, it's about coercion. It's so freaking prominent and it's a problem. But it's really hard to be like, listen, don't get the Mac Daddy stroller. I know you want it. Take this freaking birth class because you don't want to be traumatized by your birth. It changes everything. You only get one shot to birth this baby.
Right. Right. And do you know that almost everybody I see is postpartum, which is sad because I wish they came to me prenatally. But in my intake forms, there's a question, did you experience, and it's a checklist. And almost, I'd say 90% of women check off birth trauma.
Yes.
And sometimes they don't even know what that means. And that's the first time they've seen that term. And then I unpack that with them and I say, this is a safe space. So I'm still doing midwifery in that form because nobody's unpacking that. And most people are.
We are. And that's why I hired a mindset coach that specializes in releasing trauma. She works with my pregnant mamas inside my membership and my postpartum moms once a month. She comes in, does a 1 hour or longer, depending on the need.
That's great.
She meets with them. She works on releasing childhood trauma that maybe like you're bringing into your parenting experience or any kind of trauma. She works through postpartum mental health disorders and the loneliness and all of it because it's not really.
Maybe I should work with her to deal with my labor and delivery day trauma.
Yeah. And then she works with the postpartum moms because here's what I want everyone to listen to. You're the one who decides if you have birth trauma. No one else, not your mom, not your sister, not your labor nurse, not your doctor, not your partner. If you feel traumatized in any way, then you've been traumatized. And I have students who have taken my class that have felt traumatized, maybe by their labor nurse who was condescending or rude, or a family member, or maybe their partner didn't rise to the occasion. I had a provider that walked in on one of my students, laughed at her birth plan, ripped it up and threw it away.
Yeah. On the other side of it, I was the midwife. I hope none of my former colleagues are listening. I was the midwife that would come in with my patients and have to argue with my former friends who I used to work with as a nurse and get them to let her just have an IV lock, not an IV. Let her walk around the room.
Why? It's maddening to me because.
Yeah. And here I was their colleague.
And also they're the boss. But you know what I'm saying? I love labor nurses. I agree with you. We're a breed of our own. And I think they are the most amazing breed of nurses. Sorry to my other nurses, I'm partial. But there is a subset of nurses who really think that what they've been taught in the hospital is birth, but it's not. It's policies and procedures. The birth side of it is the natural side of it. Birth is a natural process. One of my friends and students, she's on Instagram, Kim Perry. If you guys aren't following her, Kim Perry Fit, she's amazing. She just delivered this morning. If you guys are listening to it, it may have been a while. Her fourth baby, she was having a home birth. She was like 42 weeks, I think, in 1 or 2 days. I could be wrong on that, but she went in yesterday for an NST. She posted in her stories the nurses were really being jerks and like trying to get her to stay and get induced. And it's like the baby passed her NST flying colors. NST is a non-stress test for those of you guys listening. You get hooked up to the monitor and we just see, how is baby doing? Baby was doing fine.
Good for her.
And this is what I teach my students. We're not going to just refuse everything because we can, but we're also not going to just go wildly into saying yes and yeah, I'll do this because out of fear. This is where I'm medical at the site of Crunchy. I still want my students, if they're going over 40 weeks, if they're going over 42 weeks, you're doing NSTs, you're doing BPPs, you're following up with your providers, you're paying attention to your body and what the baby is doing. You're not being stupid, right? You're being smart. But you're also not falling into, I have to do this because I'm told.
Right. Out of fear. It's all fear-based. So let's get back to a little bit about where do we start? Are there more tongue ties? Okay. So the one thing that I like people to understand, or that I feel like it's necessary to understand about tongue tie, is it's not just a diagnosis or an assessment that can be made based on looking in the mouth. It is a functional diagnosis. So if everything is working and it looks like your baby might have a tongue tie, but there's no symptoms with you or the baby, then it's not a tongue tie, right? We all have frenum. So in the groups that I run, I have 2 Facebook groups. One is for the professionals in my course, and one is for anybody, parents and professionals together, and it's a great group. But I don't let anybody just post a picture and say, does this look like my baby has a tongue tie? Because this is a functional diagnosis. And the tongue tie world has gotten a lot of bad press. But even before that, we have to be very careful that we're not doing procedures on babies that don't need it. So if it's not broken, don't try to fix it. So
One thing I would love for you to share is what are the steps that a mom should take if she thinks that her baby is tongue tied, or someone has said to her, or she's having difficulty with breastfeeding? Let's say it might be tongue tied, like not just difficulty breastfeeding.
yes, I think that every woman who plans to breastfeed should have a relationship with an IBCLC before she delivers her baby. That's the ideal world, right? Because we're just talking about the postpartum trauma and all the things that happen postpartum. It is so hard for somebody to try to even make an appointment with me. And I know that for a fact. Like, I've gotten people reach out and I answer them back and then I never hear from them again. And it's not because they don't want my help. They can't figure out how to pick up the phone. Like, they're that overwhelmed, especially if things are going badly, and especially if their primary medical providers aren't the ones that suggested they see me. So now this is outside the box. So I've had patients say, "Oh, I can't come to see you. I have to go to the pediatrician." I'm like, "No, come to me first." Right? Come to me first. And the ones who do say, "Why didn't my pediatrician teach me this?" So if that's ideal world, you make a relationship with an IBCLC. As soon as you're having trouble, call the IBCLC. Text her. Most of us are texting with people we've had one visit, or maybe a class,
100%
or
agree. Yeah.
even just a contact. Guess what, Lisa? I'm having a baby and I want to see you after the baby. I will answer that text with hints, as far as I can generalize hints. If you're not my patient, if you are my patient already, all bets are off. I'm giving you all the help. I'll jump on the phone with you. I've even had people come straight from the hospital to my office for helping out. So breastfeeding should never hurt. If it hurts, there's something to be done. If it's not selfish, I just did a whole episode on this. It's not selfish to expect breastfeeding to be comfortable. And the main reason for that is, if it hurts you, that means the baby's having a hard time. So breastfeeding needs to be comfortable for you and the baby, and efficient. And if it's not comfortable for you, it's not efficient, and the baby's not getting what they need. So those are things that get a little fuzzy I've heard people called selfish for wanting to do a procedure so that they could breastfeed, as if the breastfeeding was just for them, which is really, really sad.
Well, and I think we have to really acknowledge that the older generation of a lot of these mamas, like I was told, my oldest son, I had him really young. I was pretty much told that your nipples are going to be sore. It's going to hurt. You have to grip it. Just deal.
Mhm.
I remember
Right.
grabbing the chair every time he would latch on for the first few seconds. Like, this is a pain I will never forget in my life. It's the worst pain ever.
Yeah, and I say all the time, my second daughter literally took my nipple off, literally. And now I know she had a tongue tie, because she still has a tongue tie, but I didn't know anything about it back then.
But the older generation will just tell you, and I preach this from the rooftops. We tell our moms too, part of the course is preparing for postpartum, and you have to have your resource list ready, and that includes a pelvic floor specialist. We want them to see during pregnancy, a chiropractor for you and baby ready to go, preferably
Yes.
Webster certified, have your IBCLC, and a mental health specialist that your insurance covers, or someone you can afford, or a free resource in your community.
IBCLC.
Have it already, because you're right. Sleep deprivation, your booty's falling out, you're miserable, you're trying to learn this brand new human. Your brain is telling you all these things, and it's really difficult to just stand up and look up a resource. So have it ready.
So now the other thing to realize is, just because it hurts doesn't mean the baby has a tongue tie. So we talked a little bit about positioning. So seeing the lactation specialist will help you to make sure that, yes, you are positioning the baby. Sometimes I've had women sit down on my couch, and she'll go to latch them and go, "What if we just did this? And I just moved the baby's head like a centimeter." And they're like crying because it doesn't hurt. So it doesn't necessarily mean there's a tongue tie, but if it hurts, You need to investigate because it's not going to get better. And that's the other thing I hear. Oh, I'll get used to it. What is that? And I feel so strongly that I wrote a little book about this called It Shouldn't Hurt to Nurse Your Baby, all about healing nipples. Because I was sick of saying, it shouldn't hurt to nurse your baby. It shouldn't hurt to nurse your baby, that I made it the title of my little book that I wrote. Other things. So now, all right, it hurts, but you can get comfortable. But other things that happen early on is sometimes the baby doesn't seem to be transferring milk, or either the baby can't latch or they latch and they're nursing constantly and they never seem to be satisfied. Neither of those is normal.
It's
So
hell
if
on
that's
wheels.
going
I
on,
love that you said that. Okay.
you definitely want to reach out for help. And if your IBCLC tells you this is what you should do, and I think there's a tongue tie, I don't recommend going straight to getting it lasered or released. I like a laser release personally, based on experience and
Do the
research.
parents have a choice in that?
Usually, in most places, especially in the US, in most places there is a laser dentist who is trained.
So that's an important part, because that's part of
Yes.
why I've had so many students that have realized that it's a tongue tie issue. We had a pediatric dentist come in when I first started the membership, and we have that expert workshop in the recording. So when our members get their first 30 days free, and then in the membership, they have access to over 70 recordings, including this workshop, which so many of my students have watched 2 years down the road and realize they have a tongue tie issue. And it's one of our most popular ones. So I'd love for you to say that. So I want you guys to hear these steps. You need to connect with an IBCLC while you're pregnant. Doesn't hurt to even have one if things are going well, for you to connect with her afterwards. And then if you have any problems, step one, see your IBCLC, not your pediatrician.
Of course, you want to see a pediatrician, just other things. Maybe controversial, but don't be surprised if your pediatrician says there's no tongue tie without even looking in the baby's mouth.
We've had plenty of our students have ended up too, and now they're going to chiropractors, they're getting tort stuff, like all of this, and their pediatrician was like, baby's fine, this is normal.
This is what I like to arm parents with if they're brave enough. And now postpartum women tend to be very vulnerable and not feeling very brave. But every once in a while, I get somebody that uses this for me. If you don't think my baby has a tongue tie, what do you think is stopping my baby from breastfeeding? Because there's got to be a reason. But typically you'll hear things like your nipples are too small or too big, the baby's mouth is too small, the baby's too small, the baby's too big. Your milk must not be good, whatever the heck that means. Your milk isn't enough for your baby because he's big or because he's small. I've heard it all. Your pediatrician is not in charge of your baby. You are. Getting back to instincts. If your pediatrician ever tells you something that doesn't go along with your instincts, follow your instincts. Unfortunately, many of the families that come to me never tell the pediatrician they got a tongue tie release. And it doesn't matter because they never look under their tongue anyway, which is a shame, because I've had pediatricians miss cleft palates because they didn't look in the mouth.
Which is crazy, right? How's that even possible? We check that in the labor room.
Nurses do most of the time.
But shouldn't it be charted and they know it?
Please. You can have a not obvious submucosal cleft that can easily be missed, but with a thorough oral exam.
This is why I'm not a baby nurse. The babies are just too complicated. They don't tell you what's up. They can't say, hey, I've got this problem going on.
Yeah. They kind of do. That's why I said nursing, not being able to nurse is a red flag that something's up, right?
I like vaginas. I like babies coming out of them, but I'm not a baby nurse. I was a travel nurse most of my career, and if I ever got floated to the nursery back when there was a nursery, I'm like, no, I'll go anywhere.
Yeah. See, I was okay with regular nursery. Put me in NICU and I break into I like start sweating thinking about it. I was floated to NICU a couple of times.
Those little stinkers don't tell you enough.
And I was like, no, I don't do this. I do, like I said before, I do hand holding, cushy, nice, emotional support, not all the monitors and beeping. Anyway, so now even when you are pretty sure, because you've done your research and you're a mama, you've done your research and you've spoken to your IBCLC and she says, yes, there's a tongue tie, hopefully you have an IBCLC who is trained properly. And that's why I'm doing what I do by training professionals to understand that doesn't mean treatment does not always equal send for an immediate release. And those of us who have been doing this for a long time are going slower and slower every year with that recommendation because we want to be absolutely sure. Number one, it is a tongue tie causing the problem because you can have a tongue tie, but there's other things causing the problem, like low milk supply or scheduling feedings, or there could be other things that cause difficulty breastfeeding, even if there is a tongue tie. So you want to try and correct everything first. And then on the baby side of things, you want to make sure there is no torticollis, as you mentioned the word, because if a baby cannot tilt their head back or turn side to side comfortably, their tongue is automatically going to be pulled back or to the side when they try to extend for breastfeeding. So any tightness, I like to say it this way, if there's tightness anywhere, there's tightness everywhere. And it restricts movement. So we want to work on that, if possible, before the tongue tie release. Most well-trained, experienced IBCLCs who are the go-to people in this field.
Yeah, me too.
Have a list of
I'll take all
providers
of
they
that,
will
but anyway.
recommend for you, depending on what they assess in the baby. So my tongue tie resources include chiropractors, occupational therapists, craniosacral therapists, speech language pathologists who are trained in infant feeding, depending, because sometimes I'll feel muscle tone issues. And those babies need some work before, because we could release the tongue. That's not going to teach them how to move their tongue, right? We take out the frenum, they still have to learn to use their tongue. And the person that you're going to should also be giving you a plan of care for what are we going to do after the frenotomy and how are we going to be ready for it if that's necessary. So I have a lot of free handouts on that.
Oh, yeah. I would love to link to some of those in the show notes.
How to prepare for frenotomy, how to, I even have how to select a provider. So there's a list of questions to ask the dentist you go to. Do you have a network that you recommend? Because if they don't, something's up, right? Because those of us who do this know that we have to work in teams. If you have a dentist that says, oh, or an ENT who says, I can do this today, and no, you don't need to do anything else. That sounds really tempting to the parents. It sounds like, oh, quick fix. I'll just do this.
Because the other side sounds exhausting.
Yes. But I've had parents come to me. I've had hundreds of parents come to me after having that quick snip with the ENT or pediatrician who still have a tongue-tied baby, whose baby was never able to use their tongue efficiently, who may now have an oral aversion because they weren't prepared for it. So we start doing exercises before the procedure. We get mom and dad or whoever's going to be working with that baby, get them used to touching inside the baby's mouth, get the baby used to oral play, and make sure they're ready. Their nervous system is down regulated. All of them are ready. There's analgesia bought before, so you don't want to wait until you're on your way home to stop at wherever you're going to stop to get the thing that they may not even have. So preparing ahead of time is key. And I even go so far as to tell parents, when you're preparing for this, plan a little like staycation. Like you wouldn't want to have the procedure on Friday and say their baptism is on Sunday, or the other child's birthday party, or I'm going to Bahamas. I've had all kinds of stories. Oh, we're leaving for Bahamas, so we're going to do it this week. No, you want to be able to give time and relax and be in a like kind of huddling in kind of state with the baby, just in case that baby isn't a baby that bounces easily. Right. So things like afterwards, things like taking a bath with the baby is helpful. Low light, calm. If there's other children,
not running around doing errands, stuff like that.
Right. Maybe somebody else can take care of the other kids. You're not going to be doing the things that you usually do that night, the next day, maybe the day after. Now, that being said, some kids, no problem. They're back to it. Everything's fine. But some take a little longer. And we want to have that opportunity. And my goodness, we don't rest enough anyway. So we should be postpartum. Postpartum women do so much, right?
We definitely try to encourage ours to at least follow the 5-5-5, where it's 5 days in bed, 5 days on the bed, 5 days near the bed. But longer is even better.
Oh,
I'm
that's
so
great.
grateful that you came today, and I'd love to invite you into the
Yeah.
membership to do a workshop, because these moms, as you were talking, I'm thinking, gosh, I've cried with so many of my postpartum moms that are going through all of these different modalities and therapies, and they're running here and there while they're trying to heal their body. They're already feeling so inadequate for this baby. So for those of you guys listening, I know it's a lot. We know that it sucks. And I just want to put that out there, that it's okay. It's okay to feel like this sucks, because it's a lot. It's motherhood. It's hard. We gotcha. If you've already delivered, you want to be a part of our family ship or membership, you can try it out for free and then hang out with us for $19 a month. You will never find such value. So click the link in our show notes.
Yeah. But also, it's also okay to decide not to do anything.
Yeah, I agree.
It's also okay to make that choice, because this is your baby, right? And you know what you can handle. And keeping in mind that everything always seems like an emergency and urgent, but most things aren't. So if you can't handle it and you want to pump for a couple of weeks and feed the baby that way, if the baby will take a bottle, because sometimes this isn't just about breastfeeding. I've had plenty of babies that can't take a bottle because of their tongue tie, including my own grandson. There's no right or wrong. There's no absolute, right? There's just honor your feelings about it. Do the best you can. Get the best support and education. And there's lots of people that are doing the same work I'm doing. I often say, I don't want to be that busy in my office. Like I said, I mentioned my grandson. I'm a grandma. I want to hang out with him. I love to teach. I love to lecture. I don't want to be that busy clinically, but it's really sad, because I should be, because there's not a lot of lactation consultants around me. So most people are not getting lactation care. And that makes me sad. Not that I want it to be me. I want it to be someone.
Yeah, I agree. Thank you so much for coming on today. Can you tell everyone exactly where to find you?
Sure. The best place is actually Instagram, Tongue Tie Experts on Instagram. And my website is tonguetieexperts.net, because .com was already taken.
Okay, there you have it.
And I'm all over Instagram. And if you're on Facebook, the Facebook group is Breastfeeding Tongue-Tied Babies. And that's most of the tongue-tie groups are very like Wild West. And this is very well moderated. You have to answer questions to get in. There's no nonsense is allowed. And we have parents and professionals supporting each other, learning from each other and supporting each other, which is really nice. And I think we're up to 3,000 people. It's pretty cool.
That's awesome. Yeah, I love that so much. Thank you again for coming today.
Oh, thank you, Trish. This was a blast. And I feel like we could talk forever.
Thank you so much for listening to today's episode. I hope you found our chat with Lisa on tongue tie as enlightening as I did. If you want to dive deeper and get access to more amazing experts and exclusive healing hangouts and mindset coaching, be sure to join our Mama membership. It's a supportive community where you can get personalized advice. You actually have access to me and my doulas. Connect with other moms on this incredible journey. You are not alone. The link is in the show notes, or go to labornursemama.com/CMS. Until next time, you keep empowering yourself. Bye for now.